The mitral valve is an important valve of the heart. When we send blood up to the lungs, it comes back into what we call the left atrium, one of the upper chambers of the heart. It then goes into the big pump, the left ventricle, through the mitral valve. When the heart beats, the mitral valve closes, doesn't let the blood go back, as it pushes blood out to the rest of the body. Sometimes that mitral valve, instead of closing nice and flat, will balloon back into the left atrium, and a little bit of blood comes back there, and we hear that blood flow. It's called a murmur. As the heart is beating, that blood flow goes back into the left atrium. It's usually not dangerous. However, there are two circumstances that it can cause problems. Number one, if the prolapse is very significant, if there is a large murmur, then it's a place where infection can occur on that valve. So if somebody has dental procedures or surgical procedures, they may have to have an antibiotic at the same time to keep that valve from getting infected. That's called bacterial endocarditis. The other thing, the mitral valve, when it closes shut, there are some cords, some ropes that keep the valve from going back into the left atrium. They're called cordae tendineae. Sometimes those will rupture. And if that little cord or rope ruptures, then that mitral valve just opens all the way, and people go into rather rampant congestive heart failure. They get short of breath, they get gurgles in the lungs, they can't walk more than a half a block without becoming very short of breath. They know something's going on. The doctor listens to the heart, knows that there's a very serious murmur, works that up, and then that valve can either be fixed or the valve can be replaced. So if you got a mitral valve prolapse, listen to what your doctor has to say. He'll guide you through what to do.